On your screen right now, you should see the website for the CDC on the COVID-19 viral infection. Now, for anybody that don't know, at this point, if you don't know, I don't know what planet you quite lived on, but COVID-19 stands for the corona, which is the category of disease. So, other common diseases in this category include the common flu. They're not the common flu, the common cold. That is also a virus that is in the corona category. VI stands for viral because you can catch it as a viral disease. It's not something transmitted by bacterial. And the D is obviously disease. So it's a coronavirus disease. That's what COVID stands for. 19 stands for the year it was discovered, which was last year, 2019. So there's a breakdown of the virus, of what it's called, or at least why it's called what it's called. Now, to call it the coronavirus is not very accurate, and the reason why it's not is because, like I said, the common cold is also considered a coronavirus. So if you're calling this one the coronavirus, you're technically just calling it the common cold, and that is so far from correct. The common cold, I'm sure it probably could kill people, probably has. I don't have the statistics pulled up, but I'm sure, positive, it probably could. Probably wouldn't be the first time you've probably heard that, but it's kind of what happens. Sorry if you see this, I'm turning the brightness down on the camera a little bit. It's just a little too high. Contrast those two. Do I need to turn it up? No. And I can turn saturation down a little bit. It's just I have light like on both sides of me. I have windows. My desk is catty cornered in our office, so I kind of have bright sunshine on both sides of me. But I feel like the coronavirus is a little misunderstood. I don't know a whole lot about it. Not many people do at this point. This is just coming from my personal perspective as somebody that works in healthcare. So I'm going to put that out there right now. I am a healthcare worker. I am not a nurse. I am not a doctor. I am in medical school. So I'm in school to be a nurse, but I'm not yet. What I am is something called a medical scribe. Now, medical scribe, what we do is we are assigned a doctor in a hospital. I work in the emergency room. Some medical scribes are maybe in outpatient. So outpatient cardiology, endocrinology, gastrology, so forth, so forth. There may be a scribe taking those doctor's notes. However, for me, I am an emergency department medical scribe. This means that I follow the doctors. I am assigned a doctor for my entire shift, which is typically anywhere from 8 to 12 hours. My facility does 8, sometimes 9 if we have a sudden code or trauma that comes in, but typically it's 8. My particular shift is 9 p.m. to 5 a.m. or 5 p.m. to 1 a.m. So I am a third shift medical scribe. Now, for anybody that works in the emergency room knows emergency medicine is usually the worst at night or fairly early morning. Because at night you have a lot of drinking, you have a lot of bars, you have a lot of parties, you have all these factors. Plus there's something about when the sun goes down that brings out the worst in people. Now, for HIPAA reasons, I'm not even just HIPAA, just my general privacy and trying to make sure you do not find out exactly where I work. I will not be telling you the name of my hospital. I will not be telling you anything about my hospital, my client services. I'm not even going to list the name of my company, strictly because if I do, then we only have a certain number of client sites. So you can kind of probably figure out where I work based on probably my general geographical location, which is kind of all over the YouTube page, where like my state at least, because I am gonna put it out there. I at least live in the United States. I don't know if my city and my state is on my YouTube channel. I'm not sure if it is or not. If it is, then I can tell you right now, I haven't updated in a long time, so it's actually not correct anymore. I live in the same state if it's on there still, but I do not live in the same city, and I don't work in that city. So if you do somehow find out my company, you will not see what site I work at, because it's not in the same city anymore. So, now here's my history with the COVID-19. So back on the end of February 27th, I think, I caught the flu. I caught just standard flu. I tested positive for the flu, so it was confirmed that I had the flu. I had the whole cough and everything, but it was a wet, productive cough, so it wasn't the corona cough, which is dry, non-productive, and can actually lead to a sore throat. But I ended up getting over the flu. It took about a week. I had no real symptoms. I just had sore throat, which I generally thought was probably going to be allergies, because I have really bad seasonal allergies, and we were starting to progress into spring. So I figured, oh, well, it's probably just allergies. Probably not a big deal. I tested positive for the flu. That put me out of work for a week, as flu typically does. You are required a week to heal. I went back to work then in March, when the COVID-19 really started picking up. If you see me looking over, I have one monitor here, which is the monitor you can see on your screen, and I have a monitor in front of me. I'm not looking at the one in front of me, I keep looking at the COVID-19 website that you actually see on the screen. So I am going to put it out there that I'm just making my screen a little bit bigger, because I have very poor eyesight. There we go. So for me, I think it was around first week of March. I would say March 4th to about the 11th, which is typically when the COVID-19 was starting to pick up. We had a patient come in. Again, not telling you name, age, anything about this patient, except that they did travel out of state to an infected country. At this time, I cannot remember what the country was, but I do know they only had like 30 confirmed cases at the time. Probably suspected more, but this was like March 11th. By March 14th, I had a dry cough. I couldn't really breathe. And I don't know if I had a fever or not, because we don't actually, despite being a healthcare professional, I don't keep a thermometer in my house. Don't really know why, but we didn't have one. So I thought I had a fever, had the body aches, had chills, fatigue, but I never tested if I had a fever or not. So I got the coronavirus swab. I went to our local hospital, which is one of the leading trauma hospitals it's not my local, but it's my one that I trust and one that I'm familiar with. I had both of my kids there. That's where my grandma is staying currently, or was staying. She's out now. So it's a hospital that I trust. It's a hospital that I know. So I went to that one, despite it being like an hour away from me. I was put in quarantine because I had had exposure from the person that had traveled out of state, as well as a few other suspected cases that we had. We had so many coming in. We had a doctor and a nurse dedicated to testing just those patients, and that's all I did for. I think she worked in 12-hour shifts, so we had somebody just testing coronavirus patients or suspected coronavirus patients. So I had contact with a few flu negatives, but they were still showing flu-like symptoms, which, as anybody knows, is still a possible corona sign. So and we don't have the test. We did not have the test. We did not have the means to send a test out. We didn't have anything. So we suspected they were positive, but we never had confirmed. There's only 2 confirmed in my city. Well, not even my city, my county. There's only 2 confirmed, and it's at a military base. So we did end up sending those patients home. However, it was 3 days exactly, which is the earliest symptoms start showing. I believe it's 2 days. For me, it was 3. I started showing symptoms. So I went to this hospital, got tested. I assume it came back negative because I did not get a call from them. However, I still kept getting sicker. My shortness of breath got worse. Couldn't really breathe. My cough got really bad, and I still have this cough, so I'm not sure if it was started by the flu and just I've managed to keep it all this time, or what. But I was like, I'm an at-risk category. I have asthma. I have an immune system. I don't have an immune system disease, but I don't have a great immune system due to some idiotic stuff I did when I was younger. And I was like, all right, well, I'm gonna quarantine anyways, because what are you supposed to do if you're suspected? So I quarantined for 14 days. That was March. I got out of the hospital because it was after midnight. I went in, I don't know, like 9 o'clock at night, and I didn't get out until like 4 or 5. So I went in, and on the 15th, my quarantine started. I quarantined for 3 days because I needed the results. They never called me, so that's why I assumed they're negative. But I kept quarantining. I still quarantined for 11 more days to the 29th. Well, in that time period, I found out from my work that they offer a leave where if you either just have kids that may be susceptible, which I do. One of my kids is immunocompromised because she was a premature, so she came earlier than she was supposed to, like 2 months. And my son has asthma. He has a defect in his lungs that caused him to have breathing problems. So I was like, all right, well, she's already caught RSV, which if you don't know what that is, it's just a super severe cold. It is potentially fatal to younger children. She caught that twice, so she had lung damage. My son had lung damage too because he did catch it as well. So overall, both of my kids were at risk. I could not perceive going into work and coming back home having potentially been exposed and bringing it home to my kids who could possibly get sick. So I took unpaid medical leave, or unpaid personal leave. It started as quarantine leave, and then I had to actually extend it into a leave of absence for an entire month. I think I'm on leave of absence till April 22nd, so 20 more days. And I did this because even our governor is actually telling us that if we do not feel safe going into work, that we could be exposed. We are allowed to either quit our jobs and get unemployment, or to take time off of our jobs, that we will still be covered under the COVID Act that he has put in place. So that's ultimately what I did. I took off. I couldn't risk my kids, couldn't risk myself, really. But yeah, we've had confirmed cases now. So my family personally is still quarantining. We are obviously practicing social distancing as best as we can. We do have to run to stores kind of frequently because we have kids, so we do have to go get diapers, formula, whatever. But for the most part, we stay inside. We don't really go to frivolous walks or anything. We do sometimes walk over to our gas station to get drinks, but that's probably about it. Now, as for otherwise, what I'm going to turn to on the screen in just a second, this is a really good time, even if you're young, because the coronavirus is starting to affect younger people. We had the 17-year-old kid who I think ended up dying from something else but he did test positive for corona, so that could have made it worse. We had the 8-month-old infant. That was not my state. I'm just talking about general United States cases at this point. We had young, healthy National Guard servicemen. We've had an Army of Defense, so Army. We've had one test positive. We've had National Guard test positive. We've had otherwise very healthy individuals starting to test positive now. Idaris, the actor, he tested positive with no symptoms. So at this point, it is a good rule of thumb to get your estate in order if you are over the age of 70. Now, I'm not saying panic or freak out, because it's likely, you don't catch it at all. But in the case that you do, and you do not recover, some steps, even if you're young, you should probably go ahead and take care of these things now. Get them set up. I'm married. I've been married since I was a teenager. I got permission from my mom. I was signed over, got married when I was 17 years old, and I'm going on 23, and we're still married. We were together 7 years before I got married, so we were very young when we got together, and young when we got married. So, set up life insurance. It doesn't, I know it's not easy to do right now because the economy generally is starting to crash again. It is about to be 2008 all over again. In fact, I think we are lower now than we were in 2008. So, it's hard to do right now. It is. If you can't get life insurance right now, our governor, I'm sure a lot of other governors maybe, are encouraging right now to use Medicaid, use Medicare, seek out the government programs, WIC, food stamps, unemployment, everything you humanly can to provide for yourself right now. And if you have kids, it's even more important. If you have kids, food stamp and WIC are probably going to be your best friends. What else? Write some kind of will and take it. If you have a friend that's a notary, you can get it notarized, and your friend can act as the witness. They can't notarize anything for themselves, but they can notarize something for you. Notary is only like $5. Most banks will actually do it for free, if one's open near you. So you can get just something notarized, have them be a witness. It doesn't have to be through the court system, doesn't have to be through a lawyer. Just make sure it's signed, make sure it's notarized, put it away somewhere where it's easily found, or leave instructions with a family member where to find it. And this isn't just for older people, this is for about everybody, because we don't know right now. We don't know why the coronavirus is suddenly affecting younger people. We don't know why COVID-19 is, I keep calling it the coronavirus, but I mean to say COVID-19. Just putting that out there. The disease is COVID-19. It is not the coronavirus. We don't know why COVID-19 is starting to affect younger people. We do not know why it's affecting some elderly people, but some not. It seems to me like the first round of people that got the virus have recovered. So most of the senior citizens that first got it in Italy, in China, have recovered. However, the second round, the people who are just now getting it, it seems to be much worse and killing them much faster. And I'm not sure why. I don't think no one really knows why. We're just taking the precautions we need to take to make sure that we save ourselves. Because the best thing you can do right now is just a social distance. It sucks. It's financially going to ruin a lot of people. It's financially going to ruin the economy. We may see small businesses shut down, even with all the loans that are currently available. We may see families starting to break up. Like, we may see fathers and mothers splitting up because of the stress. We may see kids, unfortunately, suffering. We may see more orphans. We may see more of everything. We don't know yet. Because I'm talking like this is going to be around for months, but my government at least just released a chart saying it could be around till August. That our numbers are still going up. They haven't flatlined yet. And we don't think even with the vaccine they're going to. It does seem like we're expected to get a break where it may flatline for a little bit, where it may remain stagnant, no more cases are going up. But late summer, they're projecting it to start going way back up. And I'll see if I can find that article to put it down below. It may not pertain to your state, though. This is my state mostly, which my state, currently we're pretty good. We're lower than a lot of the other eastern United States states. We have some of the better numbers. Ours are not good. Nobody's really is over here right now. But they're not the worst either. The states around us, though, have horrible numbers. And that's why our governor is taking the action that he's taking. We're probably going to go on a full state shutdown. We're getting the stimulus checks, which for anybody that doesn't know or may not be in the United States, period. The stimulus check is going to be a subsidized check where we don't have to pay it back. It's like a tax advance kind of deal. Or it's them giving our taxes back to us, basically. So every adult who is a non-dependent, and from what I've read, I don't know if this is still how they're classifying it, dependents count as anybody 24 years or younger who are still a college student or a high school student and have been claimed by their parents. If you've been claimed by your parent and you are still in school, and your parent still provides at least 6 months of care, you are still technically a dependent in the eyes of the state. And what that means is you get nothing. That's terrible, but it's true. Even if you're an adult that's living on your own, as long as you've been claimed by your parents, you are still considered, possibly still considered a dependent, and you won't get a check. The rest of us, however, Social Security, will still get them. Unemployment, I think people who are unemployed and never had a job or just didn't file taxes are still going to get something, but they're not going to get as much as the rest of us. I think they're getting like $500, $600 maybe. The rest of us, though, the ones that are paying taxes, the ones that have been laid off, have been... This is another thing I want to get to, the layoffs. For instance, my family, we're getting the full $3,400. Reason why is me and my husband are 2 adults, so it's $2,400, and we have 2 kids, which is then $500 each, so it makes $1,000. Because we already filed our 2019 taxes, so we are going off of our taxes. And according to the calculator for stimulus checks, we are getting the full $3,400. Now, with these checks, they are meant to keep us afloat until we can return to work. Because right now, we don't know when we're returning to work. The country is still fairly under lockdown until April 30th, according to President Trump. He extended it until April 30th, so schools and stuff will probably remain closed until then. I know some schools are starting to open up in certain states, but they really don't want to do that yet. Let's see, what else? So, like, for instance, with our check, we're going to pay all the way up until May of rent. We're going to take care of April, we're going to pay May, and we're going to take care of, because I probably will not return to work until... I get paid on a bi-monthly basis, which means I get 2 set dates a month where I get paid. For me, it's anywhere from the 24th all the way up to the 10th. I will get paid on the 14th. Anywhere from the 10th to the 24th, I get paid on the last day of the month. That's not a set date because there's 31, 30, 29 days in a month. So it just depends on that particular month. But I should always get paid around the 30th. So for me personally, I don't return to work until the 22nd. If that's the case, then I only have a day of work. So that's 8 hours, maybe. Maybe that. That's going to count on my check. That's not enough to pay rent, and I won't get that until the 14th of May. So that won't be enough to pay rent. And that'll get us stuck in a perpetual loop of being late. So we are going to go ahead and pay 2 months of our rent. Keep it up. We only pay $650 a month for rent. So we're going to pay up our rent, pay up our car, because we do have a car that we're still paying off. We're going to pay up that. We only pay like $200 something a month for our car, so we're going to go ahead and pay 2 months of that. And then we're going to worry about our other bills. Our utility bill, we should be able to pay off. Because I also get unemployment because I was employed. I'm still technically employed, but our client sites are beginning to start shutting down the Scribe program currently to reduce the number of unnecessary employees in the building. So that means janitors may get laid off. Not all of them, but certainly some of them. Like the cafeteria is probably going to be closed in the hospital. Us medical scribes are going to probably be laid off temporarily. We won't lose our jobs, we just won't be at that client site right now. So pretty much, we'll be able to stay afloat with the stimulus checks, and with the stimulus check, along with unemployment. And that's kind of the intention of the government, is to keep us all afloat, keep money going into the economy, keep everybody, living, until we can figure out what more to do. Now, when it comes to the layoffs, for instance, like I just said, my client sites are starting to shut down the Sky program. I know a few that already have. Mine currently hasn't, but thankfully our company does offer something called Telescribe, which is where we scribe for the doctors, but it's through the computer. So I could be at home, dressed up in my uniform, my site all clean, which it needs to be. We just moved here in March, so everything's not unpacked behind me yet. I'm kind of lazy. I work a lot. I have 2 kids. I don't unpack right now. So, they give us options. We have options currently. We don't know how long those options are going to last. Other companies have not been so lucky. Hobby Lobby, I'm not sure if everybody heard what was going on with Hobby Lobby, but they believe that shutting down their stores is an act of God, like not shutting them down and keeping them open, and that the COVID-19 is a message from God. So they chose not to close. They got federally in trouble. The federal government stepped in and told them they were forced to close. But in response to that, they laid off several stores worth of workers. Then there's obviously the places that were close contact that were forced to close. Like beauty supply stores and stuff. They were forced to close, so they did. Most of them followed the regular regulations, despite how much they suck. Cinemas have closed down, so you can imagine there's probably a lot of jobs out. I know several other people because I live in a mobile home park. It's just a fancy way of saying I live in a trailer park, but I know several other people in my trailer park in particular are facing the same complications that we are right now. Now, I am lucky because my trailer park is owned by a family versus, say, a big corporation. So for us, they understand that there's certain things that we just can't help. So they're being very, very lenient with us, working with us. Half of them know that when we get our stimulus checks, we're all going to pay our rent. We'll get them by the end of April, from what the government's saying. So, everything should work out. But I'm just going to put this reminder out there. This is not an excuse to not pay your rent. Unless your landlord has put into explicit writing that you do not have to pay your rent for April or May or until this blows over. You do not, under any circumstances, not pay your rent, because you will be first on the bucket list to be thrown out of your home if you do not pay your rent. They will be coming for you hard and fast once this is over, once that eviction ban has been lifted. So just keep that reminder. Car lots are closed, but that doesn't mean you can't pay your car. It just means that it's going to be a little harder to pay your car right now, especially for us, because we have to actually go to the lot. They don't have an online payment system. They're an old-fashioned car lot. So just keep that in mind. It's not an excuse. Pay your bills best you can. File for assistance. There's loans, there's churches, there's so many things to offer help. Literally go on Google, type in, let's go over here. Let's do financial aid for rent. And let's say you live in Philadelphia. The statewide homeless assistance program. Assist with my rent. There's plenty. Here's a .org, phillytenant.org. There's plenty of places that are going to help you pay your bills. You just have to seek them out. And for anybody that doesn't know what the website is, I don't know if you have one for your state. You can always try. You can do benefine.indiana.in.gov. See if it exists. But if you're in Kentucky, this is the website. You log in. I'm not going to log in because you'll see my login stuff. But please, go on here or go on your state health insurance. Get your health insurance. Get it taken care of. It is not fun to be seriously sick and not have health insurance. You definitely need to. So, alright, we're going to go back to this website real quick. So I'm going to kind of spin my chair around because we're going to focus on this website that you see right here in front of you. So, here is a big thing right here. Self-checker. Little box is going to pop up. Let me move it. Oh, I can't move it over. Let's move that down then. I'm just going to move it all a little tiny so you can see this box. Alright. So, this is, as the CDC says, this is only for helping you make the decision to seek a doctor. If your symptoms sound like corona, they're going to tell you to seek a doctor. I'm going to go through this because chances are I probably need to go see a doctor again because I still have symptoms. Alright, I agree. I'm going to walk you through this, okay? I'm going to go ahead and do this with you. Chances are I'm going to get the result to go see a doctor. If I don't, that's cool too. That just means I'm healthier than I thought I was. But if I get the result to go see a doctor, trust me, I already know. I already plan to. Already setting up an appointment. Chill. Alright, hi, I'm Clara. I'm here to guide you through the coronavirus self-checker. If you are experiencing a life-threatening emergency, of course, this is going to be different per state. For me, it's 911. This is going to be different per country. This system does not replace the judgment of healthcare professionals. Ask you a series of questions. Ready? Let's get started. Where are they located? I'm located in the United States. I'm gonna go ahead and just show you what state I'm in. I'm in Kentucky. Yes. Myself. I am 19 to 29. I am female temporarily. The lightheadedness I do have, so maybe having a medical emergency. Yeah, I really don't think I am. I'm sitting here talking to you. Alright, we're gonna go through that again, just for, because if you answer yes to any of that question, it's gonna send you to the hospital. United States. Let's see, Kentucky. Are you ill? Yes. Myself. 19 to 29. Female. Not experiencing life-threatening symptoms. No. Yes. I am having a sweating. That is a big one. Shortness of breath, and I do have a cough. I've had a cough for a few weeks though, so I'm not really sure if that's related. But shortness of breath, yes. I had to get a, for this question, I had to get an MRI. And when I was laying down, I could not breathe. Not anxiety-wise, I just couldn't breathe. It felt like there's an elephant on my chest. Now, I'm aware that does sound like symptoms of a heart attack. I know very well that it's not. Like I said, medical professional, I understand these things. No. Yes. So, here you go. There we go. It's telling me to stay home and isolate. So, it's likely that I probably should go back on quarantine. I already knew this, but that's kind of been what I've been doing. But, yeah. That's the gist of that. So, all in all, my experience with COVID-19 is that you need to take the precautions. It is not a joke. It's not. I've seen somebody die from shortness of breath. It can start very, very minor, and it can progressively get worse. I've seen my son wake up gasping and gripping at his chest, and he's only 2. I've seen that, and when he was 1, it's not something that you want to see. You don't want to see your kid struggling for air. You don't see anybody struggling for air. I had a patient that that my doctor was caring for. She had some shortness of breath. It seemed like nothing. All her test results were negative. We had no reason to suspect. Her chest x-ray, everything else was negative. She was perfectly healthy as far as we could see. Well, we don't know why. Once something like this happens, they are out of our care at this point. She suddenly started crashing, and she died. We cared for her. We attempted to save her for 2 hours. We worked on her for a long time, trying to save her. Ultimately, we did not. We don't know if it was COVID-19. We believe it's something called a pulmonary embolism, which is a blood clot in the lungs. It usually starts in the leg as what's known as deep vein thrombosis. It is a blood clot in the leg. Thrombosis means clot. Deep vein means one of the further in veins. So deep vein is typically like your legs. For instance, your veins are fairly deep into your legs, like you can't immediately see them or feel them. The vein in your thigh, I believe, I think it's the femoral. Yeah, because femur, yeah. Femoral artery is one of those ones that are really deep down in your legs and you can't really see them. However, if something happens to them, it's fairly deadly. I think from your femoral artery alone, you can bleed out in a couple minutes. Let's see. So, ultimately, she did pass away. And she passed away alone. That was probably the hardest part for any of us. She passed away alone. She had nobody there. Her family was in a complete other state. Nobody could get to her. So, shortness of breath may seem like nothing, but I can tell you from experience, and from somebody that does experience it personally and outwardly, intrinsic and extrinsic, it's not the funnest thing in the world. And then a fever, well, that just makes your whole body feel like shit. You know, you get these sweats, you get, like, your body just hurts, your body don't want to move, but you feel really hot. You know, it's not something to take lightly. Oh yeah, you know, you think, oh, well, fever, I get that with the flu. Yeah, that's true. But fever is also a sign you're fighting your bacteria off. You're fighting this infection off. That's the first sign that you have something more going on. A fever may happen before any other symptoms happen. So just, at this point, I'm going to see if it says any more. Let's see. Here's some more symptoms right here. There's also some new symptoms that started coming around. They said it's super rare, but you can also develop diarrhea with COVID-19. You can develop, what else was it? A sore throat, kind of like the flu. But for most, it's fairly these three. So, watch out for these three. Just be cautious. Be wary. This is a bit of a ramble video, but it's kind of the gist of it. I'm going a little stir crazy. But overall, just make sure you keep yourself safe. Make sure you keep others around you safe. Because you may think, oh, well, I live alone, nobody's going to suffer. That's not necessarily true. You can be what's called a carrier, which is no signs of the disease at all. No symptoms. You're asymptomatic. You haven't knowingly come in contact with somebody, but now you've got it on your skin. As we recently found out, the virus can survive several days in the air and on some surfaces. I think it's like 3 days max for everything, 4 days max. And there's a chart that varies for, I want to see if I can find that. COVID-19, lifespan on surfaces. Let's see if I can find it. Here we go. Here's a chart. So cardboard, it can survive 24, copper can survive 4, but stainless steel, it can last for 2 to 3 days. Now this is without probably. And then here's another thing. So you know it can stay around for a while. Here's the official news broadcast. Here's one of the official news broadcasts. So you know it can stay around for a while. You can say you're an essential employee and you work at a grocery store. You come in contact with somebody that has it but doesn't know. They're asymptomatic. So now you have it. It's on your hands. Maybe it's on your conveyor belt at a grocery store. Maybe it's on your register. Your registers are typically made of metal, so that falls under the stainless steel, so 2 or 3 days. Say you're maybe not wiping it up as often as you should because you're slammed, you're busy, you're making hundreds and hundreds of dollars an hour, you've got all these people panic buying, so you don't think about it. Well, now say you have an elderly manager. I don't know, say she's maybe 66. I'm just gonna pull a number out of my ass. You shake her hand. You haven't used hand sanitizer, you haven't washed your belt, and you haven't washed your hands. Because you've been busy and may not have been able to. Or that's what you tell yourself. You've been busy, so you haven't been able to. I know, at least at Kroger, all registers have hand sanitizer next to them. I used it even before all this. I used it every time I rang up somebody. So, say you touch that elderly woman's hand, your manager, she moves some hair out of her face, fixes her glasses. Maybe she's eating something and somebody starts talking to her, so she does this, like most people do to hide their mouths when they're eating. Well, now she's just potentially exposed it into her eyes, into her nose, into her mouth. It's on her food that she's putting in her mouth. Maybe it's on her hands from where she's touched you. So now it's on her fork, so she's ingesting the virus. Not typically the way you get it, but you get the idea. She's getting the virus in her system. You have potentially spread it to her, so that could potentially kill her. If not, then she can spread it to several other people, because now she doesn't know she's had contact with it. You didn't know you had contact with it. You spread it to her. Now she doesn't know. By the time you find out, she's already symptomatic. She's already having symptoms. She's already in the hospital. She can't breathe. Maybe her chest is starting to hurt. Maybe unknown to you, unknown to even her. Maybe she has AFib. Maybe she has a hole in her heart. Maybe she has diabetes. Several people who have diabetes don't know they have it. Maybe she has asthma that she doesn't know about. You don't know what other people have. You look at me, you can't tell that I have 2 bum hips. I'm 22 years old. About to be 23. You would never look at me and think, you have a disability. But you know what? I do. I have horrible hips. I have no cartilage in either of my hips. Makes for incredibly painful walking. Even sitting really hurts. But you'd never know it. You would never look at my seemingly healthy 6-month-old and know that she has lung damage from 2 cases of RSV. You'd never know she was a preemie. You could look at my 2-year-old and never know he has asthma. He doesn't wheeze. He still runs around like he normally would. But if the house is dirty, or maybe there's some smoke in the air from when I was cooking, or maybe my husband ran out of e-liquid, and because he does smoke all natural e-liquids, he has a nicotine addiction. I'm allergic to cigarettes. He can't smoke cigarettes around me, so he does smoke e-liquids. Well, that's a whole other topic. And I'll say he has to smoke a cigarette because nicotine withdrawals can make people violent. So, say he has to smoke a cigarette, there's smoke in the air, maybe it's been a minute since I've changed the cat litter box. I mean, sometimes they go for a week, because if we can't get litter, I'm not going to change it and leave it empty. So, maybe that happens. If he gets around some of those, he can't breathe. I try to keep it away from him, but he still can't breathe. You never know. You would never look at my fairly healthy nurse mother and be able to tell she has diabetes. She has CPAP. She needs a CPAP machine. She has sleep apnea. She has diabetes. Now for me, couldn't look at me and see I have PTSD. Couldn't look at me and see I have asthma. You can't look at somebody and automatically tell they have a disability. There's no way. They're called invisible disabilities for a reason. And some of them are hidden for possibly their entire lives. You have to take the precautions. Invisible diseases, invisible disorders are real. Multiple sclerosis is invisible until the late stages. Lyme disease could potentially be invisible until late stages. Immunodiseases are practically invisible until late stages. Or maybe invisible all the time. There's a disease called moccasins, I think. I think it's the one where, I can't remember the name exactly, I think that's it, where they fake medical diseases to get attention. There's people like that, and typically, if they announce all the time, I have asthma, like, pay attention to me, chances are they're faking their disorder. However, there are the people who may not tell you they have any disorder, are the ones that probably most likely have them. You cannot tell. You're never going to be able to tell. You have to be careful in what you do, because your actions can unknowingly kill several people around you. Your choices can be deadly right now. Because even if you have no reported cases in your state, in your city, you have cases there. They just haven't went to the doctor. They just haven't had a test. Maybe your state doesn't have the test. Mine didn't up until a few weeks ago. My city still doesn't have the test. We had to find out by shipping them to another city. So please understand that a lot of places, just because they have no numbers, does not mean the disease is not there. It just means there's been no test. There's usually somebody around you that has it, or has symptoms, or has maybe a carrier, maybe dormant, maybe asymptomatic, but they still have it. They're still passing it on to you. You're still passing on to everybody else because you're not social distancing. You're ignoring the regulations, the laws, everything that's important right now. So that's what I'm going to end it with. Please follow your laws. Follow your state regulations. Under no circumstances should you be putting another human being at risk just because you don't feel like being inside. I lack a lot of empathy. So a lot of times I don't care about people. But even I know that this is super serious. This is something that we have not faced. Yeah, people keep bringing up SARS, but I'm going to go ahead and point it out now. The coronavirus SARS was about 0.023% death rate out of the millions of cases. Now I did these numbers about, I would say 2 weeks ago, so they're outdated at the moment, but SARS is actually still correct because it's not happening anymore. SARS has a 0.023% death rate. Corona had almost a 2% death rate. At the time, it was 1.7% death rate for people afflicted with the coronavirus. And there was less cases. So for it to be almost 2% with less cases than SARS, that is a big deal. To have a higher percentage per death rate is a huge deal. SARS is over. We don't have SARS anymore, right? I mean, we have SARS still. It's still a virus that's around. In fact, it's making its way back. A lot of diseases are. So please just follow your regulations. Don't put everybody else at risk. Yeah, I know I'm touching my face too. That's another thing. But I'm also self-quarantining. I'm washing my hands. I'm using hand sanitizer before I go in any store. I'm using it when I come out of a store. I'm using it at home several times a day. I'm disinfecting my laptop with Lysol wipes. I'm disinfecting my mouse, my phone, my fridge handle, anything I can to disinfect that I touch daily. If I could, I would dump my husband in bleach because I hug him. I would disinfect my kids. There's no easy way to do that, but the idea is still the same. Disinfect anything you hold, anything you touch, anything you may frequent. Because trust me, it will make a difference. It will help flatten the curve. It'll make it, quicker to go away right now. Yeah, it's scary. We all know the economy's probably going to collapse. Several people are going to collapse. People are going to lose their homes. They're not going to be able to eat. There's going to be more homeless. As soon as the eviction bans are up, it's going to happen. Right now, it's inevitable. What are we supposed to do? But right now, best thing you can do is protect those around you the best you can. If you have an elderly grandmother that you may go visit all the time, mask, gloves. Now, when I say gloves, put on a new pair before you touch your elderly people. If you wore those gloves when you went grocery shopping, the virus is all over those gloves. Take them off, put a new pair on. Well, take them off, sanitize your hands, put a new pair on. Then sanitize those too, because they just touched your hands. But yeah, do not wear the same pair of gloves grocery shopping and then touching an elderly person. Do not wear the same gloves and touch all of our products in the store. Shop for what you need and then get out of the store. Do not sit there and look at clothes. Do not, unless you need clothes. If you need clothes, by all means, buy yourself some clothes. But only get what you need and touch as little as possible. Because that's another way it can spread. It can spread very, very few indefinite ways. But it can spread. So, I'm going to leave on that. I know I keep saying that, but I really am now. Just make sure you protect your neighbors. Protect the people around you. Protect your family. quarantine when you need to if you start showing symptoms, and social distance when you can. So that's all I can really say about COVID-19. Okay? So I will see you all another day.